So this meeting will be recorded. We've muted everyone and we appreciate folks staying on mute and keeping your cameras off. Um, Maybe unmute yourself towards the end during our Q&A. We do prefer chat. We're going to be going over a lot of questions, so feel free to put it in the chat, and you can submit that at any time. Um, we are also posting the slide deck and recording on the Reentry website. The slide deck is actually already up. So if you'd like to follow along in that way, go ahead and go to the website and you'll find it there. Next slide. So we're going to sort of ground this webinar in our program requirements, and that'll be our introduction to just give you a really solid understanding of why we're going over what we are going over. And then we have some really great content, step-by-step process of provider enrollment, and that will be presented by our subject matter experts, George and Jamie. And then we will have time for Q&A at the end. I do want to give a quick reminder that the financial executor portal is open and that cohort 1 will be getting milestone 2 payments through this portal and cohort 2 will be getting both milestone payments through this portal. Your financial contact has been reached out to, so just make sure they are getting that set up. And if it doesn't sound familiar to you, you can go ahead and email us at the reentry inbox and we'll help you get there. So next slide, and I'll hand it on over to Emma. Thank you.
Thank you, Michaela. Good morning, everybody. My name's Emma Oppenheim. I'm the Medicaid Transformation Project Director. You've probably talked to me and Michaela and others from our team as we've worked on this program together. So I'm going to kick things off by talking about what are we talking about today and where are we in the overall plan for learning for this program. So next slide, please. So here is our milestone chart. It's gotten a bit of a New Year's revamp. And we're showing this slide again to everyone today because we want to talk about milestone 2 a bit, as well as milestone 3. So the capacity building application and our readiness assessment and how they fit into this learning webinar series that we're doing. Next slide, please. All right, so milestone 2, I think everybody is very familiar with it. That is our capacity building application. So if you go into the capacity building application and see what we've been calling our attestations form, each attestation is a program requirement for the program. And the main takeaway that we want everyone to walk away from today is that for milestone 3, for our readiness assessment, facilities are going to need to demonstrate in writing how they achieved each program requirement. So our program requirements are in our milestone 2 capacity building application, and then we have to write out how we met those requirements in our milestone 3. So our policy and operations guide, which we're still working to release, which will start being released this month, we're going to release sections that correspond to each of our program requirements. This is getting to be a lot of information, but there's more coming on the next slide. And yeah, just a flag that we will be releasing that in parts as we go through our webinars. So we are having a webinar today on provider enrollment. Then we'll be releasing the provider enrollment section of our policy and operations guide. Your heads are probably spinning. Let's go to the next slide and talk a little bit where we have this in writing. So for today, we're talking about provider enrollment. And to give you an example of what we mean, if you open up that capacity building application, go to section 4. Today, we're talking about that question number 1 under section 4, which is the provider enrollment and billing section. And so each of our webinars that we do will correspond to requirements in our capacity building application. And then when we release our policy and operations guide, it will be specifically about certain requirements in our capacity building application. So I hope this is clear today. It might take some time to digest this after this meeting. And we'll be repeating this part of each webinar every time we meet so that folks feel like they know where we're at and what we're talking about. So provider enrollment today, and then next slide, please. Just a quick reminder, here are our webinar learning series dates, as well as our approximate release dates. We're trying to release the policy and operations guides pretty soon after we have that learning webinar series. And next slide, please. So just to really hit the nail on the head here, today we're talking about Section 4, provider enrollment and billing, and that question number 1 around providers, pharmacies, and facility staff needing to be enrolled with Healthcare Authority. And so just a caveat for today. So we have a whole bunch of content on provider enrollment. We have a whole bunch of screenshots that walk through how we use Provider One, which is one of our systems here at Healthcare Authority. This webinar today is geared towards how to enroll facilities with Healthcare Authority. So we are also going to be asking for providers to check their enrollment, make sure that they're enrolled, and we're going to send a follow-up email and some webinar slides about enrolling providers and just some specific information about provider enrollment, and that will happen by the end of the month. But we wanted to focus in today on enrolling facilities and the steps that are necessary to enroll facilities. And I think that's it. We are asking that you go ahead and check the enrollment status of your in-facility staff if you need in-facility staff to be enrolled. And we'll talk more about that a little bit later. Okay, so next slide, please. And I'm just going to do a couple more slides on provider network options. This is probably not new content for you. So who needs to enroll as an Apple Health provider? This is really important, and we want to make sure that this is clear for everyone. So all reentry service providers who will bill Apple Health for providing reentry services need to be enrolled as Apple Health providers. And then the one thing that we really wanted to call out today, so if your facility is not planning to bill for services directly, in other words, if you have a contract with a vendor, if you're using a community-based partner that will be billing HCA directly for services, then you don't need to enroll your facility. But if your facility is planning to bill for services, provide services, bill for services, you will need to be enrolled. And so we also list out some other types of enrolled providers, but that's the main message today is we're talking about folks that want to bill and your facility needs to enroll if your facility needs to bill. And I know not every facility is planning to bill. So for folks that don't that are not expecting their facility to bill, then it's about checking that your community-based providers, your contracted providers are enrolled. And we can talk about that later, as well as, and happy to answer more questions about that at the end of the webinar or via email. So next slide, please. And this will just be a really quick reminder. I know we've talked quite a bit about this. So where does your provider network come from? You have a number of different options for how you could provide these services. So we've talked a lot about having a facility-based provider, facility-based pharmacies potentially provide services directly to individuals in your facility. We've also talked about leveraging community-based providers. So I'm working with a community health center that will provide some sort of in-reach care, and that will be the provider network. Our managed care organizations can also help provide some of these targeted case management services. And if you need that support, we ask that you email us and make that ask really clear so that we can work with you on that. And then we have a fourth option, which is our third-party administrator also providing staffing and some support for some of these services. And again, if you need that assistance, we ask you to email us directly. But we are probably expecting that most facilities are already planning to lean quite heavily on facility-based providers as well as community-based providers. So just kind of level setting here, and I'm going to turn things over to our provider enrollment friends who are really going to walk us through all the content. So thanks, everybody. Next slide, please.
Thanks, Emma. So my name's George Wagner. I'm the section manager for the Office of Provider Enrollment, and I'm gonna apologize ahead of time. I'm on the tail end of a bug, recovering from a bug, so my voice is not going to sound perfect. But we'll do the best we can. I'm going to talk a little bit about the overview, which is these first dozen or so slides, and then Jamie will kind of go into some of the more details on the Provider One side. Provider enrollment steps, there's a couple of things that are involved with this. Number one, in order to participate in a state Medicaid program, providers need to have an MPI. That's a federal requirement. And by providers, we're talking about, and Emma talked about it a little bit, we're talking about the facilities that they're going to participate and get reimbursed in the state Medicaid program. They need to have an MPI. And then any of the practitioners are going to be identified on claims. These would be the licensed practitioners. They will have to have an MPI. Typically um, for the facilities themselves will go out and get an MPI, and the practitioners themselves will go out and get an MPI. That's a federal website. I don't know that we have anything here, but it's the MPPE. It's website. And if you need more information on that, we can get you a hyperlink to that website on how you go about getting an MPI. So one of the things you'll want to do, especially on the practitioner side, is, and Emma talked about this a little bit, is to check on if your practitioner is already enrolled. If you've got a practitioner that is participating in the world outside of the, say, if a facility, it's very likely they're all enrolled, they're already enrolled with us under the state Medicaid program, and you won't have to enroll them. If they are enrolled, if they're not enrolled, then they will have to be enrolled with the state Medicaid program. And it's possible that some of the facilities that we're talking to here will be enrolled, but most will probably not. So those facilities will have to be enrolled. So when you're enrolling, there's a number of different steps involved, and actually Jamie's going to go over to this in more detail. But there's some terminology that's used, especially it's specific to the state Medicaid program. We use terminology like provider types, and enrollment types, and then there's the process in submitting the application, and then there's some additional documentation, especially for the facility that we're going to look for. For the practitioners, you probably won't need additional docs, but the facility most definitely will. And then that last step is once the application is submitted, it will come to my team, provider enrollment team. And what my team will do is we will look through the application, make sure everything we have, and then approve it. Now, one of the things, and we'll probably talk about that here, we ask providers to expect at least 30 days for us to get to an application. And we'll do our best to get to these and make sure that we meet that requirement. But we probably won't get to them much faster than that. Um, and then also, if you're participating in the on the managed care side of the business, you'll also have to get um, set up a contract with the MCO, and then the practitioners will need to be credentialed with that MCO. And their process is probably it's a little similar to what my team does on the enrollment, but the credentialing process is a little more has a little more involved. So we can go down to the next slide, please. All right. Oh, this is the MPI slide. So the MPI, and actually it stands for National Provider Identifier, is a unique 10-digit identification number, and this is issued by the feds, Centers for Medicare and Medicaid Services. It's not something that's issued by my team. All reentry providers will need to go out and get an MPI, and that would be including the providers, the practitioners that are participating in the facility that are going to participate in this program are going to need to be identified on claims. Individual healthcare providers obtain a type 1, and then facilities obtain a type 2. You don't have to be experts on that. The feds will actually walk you through that process. as to what is a type 1 and a type 2, and you're not going to need to be real knowledgeable about that. And then providers who have an MPI, you can just skip this step completely. And then we do have a hyperlink to the MPPS website here on this slide. Thank you. Go on to the next slide. So as far as checking on a current enrollment status, if a provider is participating in the private industry, their clinic will know. If they're a clinic, will know whether or not their practitioners are enrolled. If they're a servicing provider practicing both within your facility and without, it's very likely they will know whether they're enrolled with the state Medicaid agency. If correctional facilities should contact the healthcare providers to confirm if they already enrolled in Apple Health. Once you actually get your facility enrolled in Provider One, you actually can do that yourself. You can go out there and check and see whether or not a provider is enrolled with the state Medicaid agency, and if they are, you can associate them to your facility. So that process will be a lot easier once you get your facility set up. So, like we were talking about, most community-based providers are likely enrolled as Apple Health. And then those providers that are already enrolled, they don't need to be enrolled again. Even though they're participating, they're new to this program. The provider that's participating in the state Medicaid agency, HCA, they only have to be enrolled once, regardless of the number of programs they're participating in. Facilities that plan to leverage their in-house staff should confirm whether or not the providers are already enrolled in Apple Health, and that actually, again, once your facility gets set up in Provider One, you can go in there and check yourself. Your team can go in there and check yourself. So a couple of things here. What our goal is here, what Jamie and my goal is to kind of give you an idea of what to expect to get into Provider One. I can tell you, Provider One is a fairly complex system, and it's not super friendly. But we want to give you an idea of what to expect when you start using it. And then also, this phone number right here is going to be key to you. My team, I'm going to brag a little bit. As far as the phones, I think they're the best in the business. They're really good at what they do. And they will take the time that a provider needs to help walking them through an application or answering other types of questions. They're really good at what they do. Our phone numbers open. Toll-free line is open Tuesdays and Thursdays, and we try to keep our staff. We try to keep those phones staffed during those hours. And then the MPI, when somebody calls in to this toll-free number, is going to ask for the MPI and is going to get grumpy when you don't have it. So you want to make sure you have your facility MPI when you're calling in. All right, we can go down to the next slide, please. So this is where we're talking about some of this terminology that's used unique to Medicaid and actually specific to HCA. So when we talk about billing providers, we're talking about typically in your case, it's going to be a facility that's enrolling. It'll be your jail or DOC facility that's enrolling. Those are going to be the billing providers. Now, if there's a clinic out there that's participating in this program, that clinic would be a billing provider, and we do it within the state Medicaid agency. We enroll a number of sole proprietors that would be licensed healthcare providers who wish to bill Apple Health, but I don't know that there's going to be a lot of providers that are going to participate that are going to be sole proprietors that are a part of this program. Mostly with regards to billing, it's going to be your facilities. So the second category is healthcare professionals practicing under a group or facilities. These will be we have a specific provider type that we call the Provider One calls these. They call them servicing providers. So these are licensed healthcare practitioners who are going to be participating in the facility need to be identified on claims. And there was a couple examples there, physician, nurse, and probably we'll see quite a few physical therapists, occupational therapists, things like that. We can get on to the next slide, please. My screen's not going down to the next slide yet. Oh, there we go. So this one looks like the one that we just were at.
I think we had two of the same slide.
Yeah, there we go. All right, we did some last second movement on the slide, so apologize for that, guys. All provider applications must be submitted through the Provider One system, and so most of what you're going to be doing for the facility, there's an external portal that you can use to submit applications, and that it's located on our provider enrollment website, which is in that blue box there on the right side. That's where when you providers are initially enrolling to participate in the state Medicaid agency, that's the process you're going to use to enroll your providers. Now, once your facility is enrolled, you actually can submit applications for your servicing providers directly from Provider One. You don't have to go through this external portal, although you could if you want to. So there's some specific terminology again that's in Provider One that's used to identify providers. And this Provider One's going to ask you to choose some of these for your facility. You're almost always going to choose the facility, agency, organization, institution, enrollment type. You're always going to want to do that. That particular enrollment type you'll probably see it truncated under the acronym FAOI, and that was what you're going to use to enroll your facilities. Individual billing providers we've talked about, you probably won't be using that. But if we do have providers that are participating in this program, we certainly will support the enrollment of those providers. The attending servicing provider, that's the one that I was talking about, where those are the practitioners that are going to be enrolled that are participating under the facility MPI. So we do have a process. If you have a large number of, say, employees participating in a facility, providers do have the ability to use a bulk enrollment process. It's actually listed on that HCA provider enrollment site. It has instructions on how to use that. Some of our larger providers will use that, like say University of Washington, OHSU, Multicare. They use it quite a bit when they're submitting hundreds of applications or hundreds of updates. And you wouldn't have to if you've got a smaller volume, say 15 to 20. You could also use this bulk enrollment option for that. And really, it's collecting the same information that we want. That the system will collect on for individual applications. It allows you to submit a spreadsheet with this information to streamline that process. The only caveat I have is make sure you pay real close attention to the instructions, because the formatting on that spreadsheet has to be perfect, or else our system isn't going to like it. So there is no application fee for the facilities. You will probably see that on our website. We'll talk about that. Other types of providers participating in the state Medicaid program, we will require the application fee from, but for this program, we are not. Right, let's go on to the next slide.
We're going to actually go back a slide because I think we did skip step 3B, which looks really similar to 3A. So 3A is provider type, 3B is enrollment type. George, do you mind picking back up here?
Sure. Sure. And this is, again, this is the reason we're doing this. This is terminology that HCA uses in Provider One, and it's good to know what which enrollment types to use that are applicable to your business. So like for a billing provider, and again, when you're enrolling your facility, you're going to want to use that facility, agency, organization, institutional enrollment type. You're going to want to choose that. If you've got healthcare professionals practicing under a group or facility, the, and I don't know that we have it listed here, but Jamie will talk about it a little bit. The enrollment type you're going to want to use is individual, and then there's a servicing type is servicing only. So those are some of the terminology again that Provider One uses. Thanks, Emma. So we talked about a little bit about the process, and one of the steps early on, we were talking about some documents that are required. This is a listing of the documents that are required to participating in the state Medicaid program with HCA. A lot of these again are driven by federal requirements. I mean, the W-9 form is pretty standard to do business. That's something we'll need. A debarment statement, that's a federal requirement. And then the core provider agreement is something that's the actual contract between HCA, although technically it's called a provider agreement, but that's the contract between HCA and the provider if you're participating in the fee-for-service program. Trading partner agreement is not something you're going to need to do unless you're using HIPAA transactions, electronic transactions, and like if you want to go out and get you want to do batch eligibility, client eligibility, or you want to do something like batch claims, or you want to do business, say, with a billing agent clearinghouse, then we might ask for a trading partner agreement. But if you're just participating under the fee-for-service program, that is probably not something you're going to need to do if you're submitting claims one at a time. And then again, this is going to be almost exclusively for billing providers. It's going to be rarely are we going to ask for documents for professionals practicing under a group or facility, something we call servicing providers. Not something we're going to ask for very much. Pretty much those particular applications are pretty streamlined, and once you get familiar with them, once your team gets familiar with them, they'll be pretty easy to submit. Great, thank you. So this goes back to the timeline that I was talking about. We ask you to expect at least 30 days, and then recommend that you can get the application submitted proactively. Make sure that we have time to get to them. Once an application is submitted, an application, once my team gets to it and approves it, there will be a welcome letter will be sent out, and there'll also be some instructions on how to get access to Provider One. Those are both automatically generated by Provider One when my team approves the application. So one of the things you'll see, especially there's a lot of information that's required, like those documents, and then how we go ahead and enroll providers and the enrollment requirements. Almost everything that you've seen us talk about here is driven by federal requirements. It isn't because George thinks that we need to do it. Almost everything we do is driven by the feds. The feds say, hey, state Medicaid agency, and when you're working with your providers, you have to do these items. Or you can go down to the next slide. Right. I think this is our transition to Jamie. Any questions for me, or how do we want to do that, Emma? Do you want to do that now, or do you want to do it at the end?
So we have a number of questions in chat. I think that we hope that many of them were just answered, but we were actually hoping to maybe do a bit of a pause, George, and have you reiterate some information. And I'm going to have Michaela talk us through some of those questions.
Sure.
Yeah, thank you so much, George. I'll go ahead and start a little bit more broadly with Dr. Stern's question, which is please provide a definition or examples of provider and practitioner.
So, and again, I think a lot of this has to do with what the HCA definition. This is definitely not an industry-wide definition. So a provider with regards to the state Medicaid program, and this is actually um, this is a CMS definition. This is any provider that has an MPI that's enrolled with the state Medicaid program. So that would be any provider. That could be billing or servicing or a practitioner enrolled under a billing provider. And then, so it's a really general definition of what a provider of a entity. It could be an individual or organization provider practicing in the state Medicaid agency. So a practitioner is a more specific definition. That's a individual. It's going to always be an individual that's participating in the state Medicaid program. So those are kind of the differences. That's why we went through to kind of further articulate like the difference between a provider. We were talking about billing providers, which is the facility enrollment, and then we have the practitioners, which is the individuals that are enrolling, typically under the facility organization. I hope that helps a little bit.
Thanks for that, George. I think that's helping with some clarity. Emma, this next one is for you. It's more programmatic. And the question is, if we have still not fully submitted or gotten our budget approved, are we behind?
No, that's a great question. You're not behind. And I would actually say no such thing as behind. We're going to work with a facility to meet every requirement along their own timeline. So what we're actually recommending is for most facilities, unless you feel like you've looked through that attestation form and you fully understand every requirement super well and how to do it, we actually recommend go through our learning webinar series, go through our learning series, read our policy and operations guide, and as you understand the steps necessary to meet each of those requirements, just begin that work. And then we will work with you on your timeline to get you started. So I think nobody's behind right now, and we're just thankful that you're all here doing some good learning.
Thanks, Emma. And I think we may have answered this next question already, but I'll go ahead and ask it, which is, should providers be enrolled as a group, a facility, or both?
So for this particular program, we would recommend you use that facility, agency, organization, institution enrollment type, not use the group enrollment type. That's what we're going to recommend. And really, it has to do with provider one limitations more than anything else. If you use the group enrollment type, it can really cause some issues with certain kinds of services because that group was really designed for the private industry side of the world, where you have groups of practitioners that are only participating in the state Medicaid program, providing professional services. And my understanding is this program is going to be a little more extensive than that. So we would definitely, if you're enrolling your facility, make sure you enroll under that facility, agency, organization, institution enrollment type. I think the only other exception might be is if this is if you've got a tribal entity that's enrolling, that tribal enrollment type will act very similar to that facility, agency, organization, institution, then that tribal enrollment type would be more appropriate.
Great. Thank you, George. And I think you may have just sort of answered this question as well, but I'll go ahead and just in case, read it off. In an effort to enroll our facility, I've been able to get clarity on provider type for our correctional facility. I was referred to a specific WAC for the list of provider types. Correctional facility is not an option. What types of providers are correctional facilities? I think a lot of folks are maybe using the HCA PDFs that walk folks through how to enroll. And a lot of the examples listed are hospitals and things like that. So that might be where some of this confusion comes from.
Well, and there part of the application will ask for is the uh, HCA uses taxonomy systems to identify a category of provider, like to identify the difference between a hospital and a pharmacy. And also we use to identify the practitioner provider types. And that may be what that question's getting at. So for facilities, what we would want you to do is, Jamie's going to talk about it a little bit. There's one or two taxonomies we would want you to use currently to enroll the facility, and then we'll branch out later as the program gets more developed. For individuals, when you're enrolling individual, then what you would do is you would use the taxonomy that's most specific to the provider type. Like if you're enrolling a physician, use one of the physician taxonomies. If you're enrolling an occupational therapist, you'd use one of the occupational therapist taxonomies. So I hope that helps with that question.
Thanks, George. We're just going to ask one more, and then we're going to get moving on the rest of our presentation. Um, the question is, does a facility with an in-house pharmacy need a separate NPI for pharmacy billing, or is billing done using the facility's NPI? And sort of to bounce off of that, does a facility with an in-house pharmacy, oh, I'm sorry, does in-house pharmacy also include those of us who store and administer the MOUD and MAUD medications only?
So I'm going to talk in general as far as how Provider One is designed and how HCA supports organizations. So what we do at HCA is we try not to limit how a provider wants to do business with us. We've got some organizations out there, some businesses that could have as many as 100 different locations that they have identified with one NPI. And if they have set themselves up with the feds to get that MPI, in that case, that's something we would support. So if you wanted to do business under one facility MPI and have all your services run through that, what we would have to do eventually is get those taxonomies added related to those other programs. And then if there's more than one location, add the locations onto that particular provider record for that MPI. But you don't have to have more than one MPI. Now, the negative part about that, and this is something I've had conversations with providers in the past, is that when you're billing fee for service and you get your MPI, when you get your explanation of benefits back after you get your claims for that MPI, all the claims are going to be rolled up under that one MPI. So all the pharmacy claims, all of the professional claims, all the facility fee claims, everything is going to be all rolled up under that one MPI. And it will be your team's burden to go out there and break it down for your business to make sure the information makes sense and meets your business needs. What some providers choose to do is to enroll, say, a particular line of business under a separate MPI, go out and get an MPI like for their pharmacy and enroll that line of business separately. That way they get a separate EOB. And then if you want to do that with other parts of business, you sure can. That's not something we're going to determine for you one way or another. That's going to be up to you. And if you do that with more than one, like if you have more than one, go out and get more than one organizational MPI to support those different books of business. It'll be more work on the front end for you because each one of those MPIs would need to have an application and they would have a separate process for enrollment. Some providers like it because it really helps facilitate the claim side, making sure they get the claims, the payments not tied and associated with the correct accounts. I hope that helps with that.
Thank you so much, George. I'm going to go ahead and pass it on to Jamie to do the process walkthrough.
All right. So first I want to introduce myself. I am Jamie Granston, and I want to give you a little background of how I got here. I actually worked at Stafford Creek Correctional Center for a year, scheduling all offsite medical appointments for the offenders that were there. I moved from DOC to headquarters where I actually processed the bed day bills. So some of you jails will know what that is. And then I came here to HCA to help providers enroll into Provider One. So that is a little background about how I got here, and you can go ahead and go to the next slide. I'm going to go over how you're going to enroll your correctional facility. So this is what George was talking about when you're choosing your enrollment type. For the facility, you're going to choose the facility, agency, and organization. The direction, I know there was a question about group versus facility. Facility doesn't require any attachments or servicing providers added to it, but group does. So that's kind of why we went with this direction, is to get you all enrolled first. And then we can add the other information or providers later. Let me see. Go ahead and go to the next slide. So once you choose facility, agency, organization, and institution, your screen is going to look like this. This is going to build your profile or your application. So you're going to choose HCA from one of the selected agencies from the left and move it to the right. That pops open that box there that says HCA billing type. You're going to leave that as billing. The next is provider name, organization name. That is going to be your name of your facility, and this name needs to verify with the IRS with that EIN that you're going to put in there to the right. The organization business name is a DBA, or a name that if you're having several of these, you can be able to identify which domain you're in once your application is processed. The next is George was talking about an NPI. You're going to choose yes in that drop-down box and enter your type 2 or organizational NPI in that box there. It does ask for your UBI. UBI is to the right. It is your business license number. That is not a requirement on this screen because we do have to add that into another step. The next is W-9 entity type. This would match what you submit on your W-9 as one of your documents. Other organization information is required, but we don't review this at all. The contact email address is an address that if we have questions or problems with your application, or we need documents updated, this needs to be an email address that when we reach out, someone is monitoring it to be able to get the information back to us so we can finish the process of your application. We are currently using that enrollment effective date slot. I'm not sure if they've told an enrollment effective date just yet. And let's see. Next slide. There we go. So once you click the next button on that previous screen as you're building your initial application, it's going to give you an application ID number. It emails it to that email box that you put on the screen prior. Make sure that either you got the email or you write this number down, because we are not allowed to give this number out over the phone for security reasons. Next slide. When you click next, it will bring you to it will bring you to a list of 17 steps. The first step that it will show you which ones are required. The first step you're going to go into is going to be labeled as step 2, add location details. And this is just a little screen snippet of what you're going to see on that screen. You're going to want to put in your business name, a contact person that if we need to reach out. And again, there's another email address in here that we would also reach out to, this one or the one on the front screen, and they can be the same. The end date is 12/31/2999. We use the infinity end date. Also on this screen, if we were to scroll down and it was the screen we're working on, you're going to add locations. You're going to add your base location, which is where the facility is actually located. You're going to add a mailing address, and you're going to add a pay address so that if you choose paper check when we get to that step, it will mail the check to that address. All three of those can be the same address. Next slide. Okay, so this is where they were talking about specializations or taxonomies. We are going to ask that you can add this group taxonomy. So when you click the add button in this step, you'll build the taxonomy or the specialization. You can see that says provider type 19, specialty 32. The one that we are going to ask you to use, and I think someone's going to put it in the chat for me, is the one that's called prison health. So it would show as provider type 26, 1Q as the specialty. And then once you put those two things in, it's going to list a whole bunch of options down here. And you'll want to search down for the one that says prison health. What that allows us to do on the enrollment side is we can pull these applications by taxonomy. So it allows us to pull those a little quicker and get you to go to the head of the class. Next slide. So this step is, there's going to be two things you add into this step. This is called the ownership and managing controlling interest disclosures. The first item you're going to do, this screen is actually showing managing employees, but you're going to do a disclosure type of owner and disclosure category of owner, disclosure type of organization, and you're going to add your organization back in to as an owner. And the other item that you will need to add to clear this step or to be able to satisfy the requirements of the system will be to add a managing employee. They do have to have a social security number and a date of birth. The address they use can be the facility's address. So you'll end up having two additions in this step 4, an owner as a disclosure category and an individual or a managing employee. Next slide. Okay, so, and I will say in each of these steps, you'll go into the steps. So you'll click on the blue words that display. And when you click the close button, it will bring you back to the list of steps and you'll just go into the next one. And this is the next one. So for these enrollments, if you choose the two taxonomies I suggested, you will only need to add a business license. It will be what the number license certification type will be business license. The number will be that UBI number that we talked about that comes from Department of Revenue or Secretary of State. The state of licensure should be Washington. You'll want to put your effective date of that business license, and the end date we use for these is 12/31/2999. Next slide. Let's see. The next section that you'll look at is going to be steps 6 through 8 are optional. Step 9 is, let me see. Provider will display already entered information. So step 9 is your federal tax details. If you click into there, you're going to click on the W9 blue words, and it will autofill everything that you already filled in step 1 and step 2 locations. Step 10 through 14 are optional. That was where George was saying that if you have a clearinghouse or a third-party vendor. Step 14 is eventually, once we get your enrollment approved, you would add your servicing providers in this step. And next slide. Step 15. This is where you can either choose or leave it as paper check. Or if you have your financial institution's information, you can add in the name, the routing number, and the account. Make sure it's an EFT direct deposit account number. For EFT account type, you will choose corporate. And missing from the snippet at the very bottom is authorized signature. It's just you just type your name in there and click the next button, and it will add your banking information in. Next slide. And let's see. So this is the second to last step. This is step 16. In step 16, you'll answer these questions as a yes or no. And we want you to focus on if you've ever had any federal or state actions against your facility. If you answer yes, please put comments in the comments and also upload any documentation or explanation that you need to upload in the upload button, which we'll get to in just a second. And next. So this is the very last step. This is the submit enrollment step. Inside this step, there's a button that's there in the little box that says upload attachments. This is where you're going to upload those documents that George was talking about, the core provider agreement, the debarment statement, the W-9, and if needed, the trading partner agreement. That you can upload them all as one file. We do need all the pages of them, not just signature pages. And you can upload them in one file or separately. And when you file name, this is a little tidbit that comes up sometimes. When you name the file, don't put any punctuation or characters in the file. Naming it as core provider agreement or debarment statement allows it to be uploaded into our system because there are some limitations. And this is where you could upload any other documents that you wanted to provide for like if you answered yes to any of those questions. And next. Now we're going to go to best practices. Next slide. Okay, so I want to make sure that you write down your application number. This is very important. This is the only way that you can get back into your application. And again, we can't send it out over we can't give it out over the phone, but we can send it out through email. Next slide. And this is just a follow-up of you're going to choose facility, agency, organization. Your name needs to verify with the IRS. A type 2 NPI, which is what George was talking about getting from NPPS. An email address that someone is going to monitor, a name and social security number, date of birth for your managing employee. The taxonomy that we had put in chat is what we would like. Business license, and any other license or certifications that come up for other taxonomies that you might choose, which you can also give us a call and if you're wanting to add those taxonomies. Banking information, any outside state or sanctions, or I'm sorry, any state sanctions or federal exclusions, and your documents. And it might seem a little overwhelming, but I will tell you if you, again, like George said, if you call our team, we are customer oriented and we will help you get whatever you need done or any questions that you have answered. And I think that is my last slide. Thank you.
Thank you so much, Jamie. So I know we're pretty much at the top of the hour. I think if we're able to, we're going to try to do 1 to 2 more questions. But given the time right now, please, if everyone could continue to ask questions, so I know there's more questions out there, please send them to us via chat right now or via our email. We're going to follow up on this conversation with some information in writing just to make sure we get everything. Maybe I'll turn things over to actually Erica. If you're on and you want to ask 1 to 2 more questions, I see that you have a good list started for us.
Sure. So one of the questions in the chat was, does each location need a new NPI and facility enrollment, or is one enrollment of even for multiple locations? There might be a bigger part of that question. Go look at.
Well, I can answer that one. And I was talking about this a little bit. That's really going to be the choice up to the facility. If you want to go out and get an MPI for each facility location, you certainly can do that, and we'll enroll each separately. The advantage will be is that each of those locations can bill separately under those MPIs, and will receive a separate yield explanation of benefits for the claims. The other alternative, if you want to enroll all the locations under one facility MPI, you can certainly do that. It will be easier to enroll with us to do that. The negative part will be is that when you get your explanation of benefits, all of the claims for all of the locations will be rolled up under one explanation of benefits, and it'll be more work for your team to split out if you need to identify the different locations.
The other part of that question is there an easy way to transfer out of group practice to a facility without starting completely over?
That one I would call my team about. I'm not sure, to tell you the truth, but I would give my team a call. It might be easier just to for us to for you to back out of that application. What we'll end up probably doing is purging it and restarting it, but that is not something I'm certain. But you would want to call my team for help with that.
Okay, and I wonder if it might be the same for this question, but I'll go ahead and ask it anyway. About 5 years ago, the DCYF and JR submitted an application for a licensed healthcare professional practicing under a group facility. We submitted applications for each provider for enrollment for a non-billing provider organization. Is it possible that we be converted to billing provider, or do we need to resubmit?
So if you want to enroll a facility as a billing provider, that will have to be enrolled separately. I'll have to get new applications for each one of those locations. I'll need a new application for each one. Actually, we did something similar with DOC for some of their locations.
Great, thank you.
Okay. So I know we're at the top of the hour and we want to be really respectful of everybody's time. Thank you so much, provider enrollment team. Thanks for everybody attending today. We know there are still a number of questions. We did want to just do a teaser. We have upcoming webinars coming almost every week through the next couple of weeks. So we really hope to see you there as well. And we have some information on who from your facility should attend as well at the bottom of this slide. So please take a look at that. Thank you so much. Links are in the webinar deck. This is posted online, and please email us with any questions. So thank you, everybody. We also have some overview information that should be familiar to you at the very end. So thanks, everyone. Talk to you soon.